In summary, although CBT is a systematic and structured approach, it is also sufficiently adaptive to individual client needs and not prone to bias. The client is empowered and leads the process, including goal setting. It is very important that the therapist always considers the abilities, preferences, expectations, and perspectives of individual clients in order to ensure that the treatment plan and delivery is at the appropriate level. Based on research, CBT is based on processing and modifying negative conditions, and therefore, research considers CBT effective for mood disorders such as depression and anxiety. According to CBT, behavior problems are the result of dysfunctional thoughts and feelings. Therefore, CBT, according to the research, is effective to reduce conduct problems such as anger and substance abuse. The consequence of trauma is negative changes in beliefs in order to cope. CBT is effectively applied to address these negative beliefs, reducing symptoms of PTSD and other trauma-related conditions. Personality disorders are strongly related to maladaptive beliefs, and as long as the client is willing to comply with the therapy and establish a meaningful relationship, CBT can potentially successfully reduce problematic symptoms. CBT is effectively applied in prisons to improve well-being of prisoners, institutional safety and security, and reduce relapse and release. CBT is considered an effective treatment based on research for many older people, children, and adolescents, but the process has to consider their individual needs and abilities. CBT is value neutral and empowers the patient in the process. Therefore, it is useful in multicultural populations as long as the therapist considers the culture-specific characteristics of the patient. Some of the limitations of CBT or possible conditions that may not be suitable for the application of such treatments. CBT is centered on identifying, understanding, and disputing thoughts. Young patients or patients with severe cognitive abilities may not have sufficient ability to participate in such a process. Patients have to be willing and able to comply with treatment and establish a meaningful therapeutic relationship. These characteristics of some personality disorders, such as antisocial, narcissistic, and paranoid personality disorders, often prevent this. CBT requires patients have insight into their disorders and in touch with reality. Patients with serious psychotic symptoms are often not able to benefit from the CBT process, according to the research. CBT is structured and systematic. Some patients find this approach impersonal. CBT is present-orientated. Some patients may feel that their past experiences and cultural roots are downplayed. CBT is often criticized as a confrontational therapy as patients' thoughts are disputed and viewed as inaccurate and illogical. Some of the objectives of providing CBT for prisoners, for example, are preventing relapse after release, increasing social and interpersonal skills, improving institutional behavior such as safety and security, normalizing experiences and allowing for healthy alternatives, reducing emotional distress.